Hello, I'm Janice Karen, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. And if you'll move to the first update. So this is the big one. Excuse me. The federal government has put up the spring 2023 unified agenda, and I looked through the HHS section as well as FTC, OMB, and a couple of other places where there's some likelihood of having rules that we might care about. And so we'll just go through what's listed. Some of them are things that have already been on our radar. Some of them aren't. Excuse me. So the first thing that's going to come up time-wise is something we have talked about before, scheduled for September 2023. They're calling it the disincentives for provider information blocking proposed rule. This is the rule for how for the penalties for information blocking on providers that will be overseen by ONC. So we can expect that NPRM to come out in September, assuming it's on schedule. And we've talked about that before, and that's expected. So we won't spend much more time on that now. OCR is planning a final rule for Part 2 data privacy changes. There apparently was a proposed rule for this that came out in December of 2022 at the same time as the CMS prior authorization interoperability rule and the attachments rule. So we missed it. So sorry about that. There was a lot going on with rulemaking at the time. And so a final rule related to those changes is scheduled to be released in October. Scheduled for November is the ONC HTI-2 rule. There is no information proposed rule. We expect, the industry as a whole expects this to be somewhat based on, somewhat focused on prior authorization, but there's no specific information about what it covers available at this time. We'll have to see in November. In moving into 2024 now, a CMS final rule on NCPDP pharmacy updates. There apparently was a proposed rule around this November of last year, and so this is the final version is expected in 2024. I will say that the time frame between when these NPRM comment periods are ending and when the final rules are coming out seems to be getting longer. But we'll see if that remains a trend. March 2024, big ones. So they have put on the books No Surprises Act, Advanced Explanation of Benefits proposed rule for March 2024. It is not clear if that will include some of the other pieces of No Surprises that are awaiting rulemaking, or if it will be strictly focused on the advanced explanation of benefits and basically coverage for patients that have health insurance. But we do know that it is intended to cover the AEOB process at a minimum. So the next, also in March, OCR is scheduled to put out a proposed rule on how they plan to distribute the fines that they collect for privacy and security violations. The rule, the mandate is that, I'm not sure if it's 100%, but at least a good portion of the money collected for violations is supposed to go back to those who are violated. And so there is supposed to be, so this is the plan for how they're going to figure that out and do those distributions. So we'll see what that is. Now here's the very interesting one. April 2024, a final rule for attachments. So there's some speculation that there wouldn't be a final rule, that there would be perhaps another proposed rule, or that there would be some time of going back to the drawing board to figure out if they were going to update the rule to incorporate some of the requests for fire or what they were going to do. Apparently, the current plan is to go directly to a final rule, but not until April. So we'll have to see what's going to come there and if that plan changes. But that's what they've announced now, kind of quietly, by putting it in the unified agenda. In May, there is a rule that's going out for standards for, it's called Standards for Data Exchange. And it does involve healthcare information. It's for child and family services type things. So it's not just healthcare, but it's for all of the groups of things that fall under child and family services. So social services, as well as healthcare related items. And then the last thing that caught my eye, and I believe OS is Office of the Secretary. So this would be basically the overarching HHS organization, and a proposed rule on updates to the Privacy Act in May of 2024. Some stuff that did not appear on the unified agenda. A final CMS prior auth and interoperability rule. I had a chance to ask Alex Mungy about this yesterday, and I did not. What she said is that just because there was not a specific listing does not mean there aren't intentions to finalize it. What that meant was that they were not putting a specific date on it. However, as long as it's finalized within 3 years of the proposed rule going out, it is still totally valid and still totally in the works. They intend to do it much sooner than 3 years. She did not give a specific time frame. And she did say there was a way that you could see rules that are still on the agenda but fall into this category, but I couldn't quite figure it out. So I'll have to listen to that session again. This was in the CMS HL7 Fire Connect-a-thon. And so I'll have to listen to that session again to find out exactly, follow the exact mechanism that she provided for finding that in the unified agenda. And hopefully I will be able to do that and report back. So it is there. It's not obviously listed. It doesn't have a date attached to it. They are still diligently working on it. The other thing that was not there was the OMB race and ethnicity proposal. Now, it is not clear to me if the draft was on there either. So it may be that this, for some reason, does not have to be part of the unified agenda, or it falls under some other category like that doesn't require being listed in the normal way, because clearly there are things where that's true based on Alex's answer to my question. So I'm not sure what's going on there. We haven't gotten an update since we sent in our comments on that and since the comment deadline. The original proposed draft said that they were hoping to take final action in the spring. And I think they might have said by June. I don't quite remember. Don't count on the exact timing, but certainly we were expecting it to happen before now. So we're not clear what's going on with that. As far as we know, it's still in the works, but it's not listed here. So you can find a link to the full agenda there. And what you do, that is the entire executive branch. And there's a drop-down menu where you can select either the department, or in some cases, it's split further by agency. For instance, HHS is one thing, and then on the HHS page, it lists each rule has the specific sub-organization that it's associated with. But the FTC is not listed under the Commerce Department. It's listed separately. So sometimes you may have to look for either the top level agency or the group if you're looking for something specific. But in theory, the entire set of upcoming federal regulatory plans is somewhere within that agenda. Any questions or comments about any of this?
Well, Janice, just one comment. The prior auth rule, obviously it has a deadline in it of the end of 2025. So, I mean, obviously everybody's aware that the longer the final rule takes, the less time really there is to implement. So, obviously our take is to start implementing now because we know it's coming. It's just a matter of that time window is shrinking between the final rule and the proposed implementation date of end of December 2025.
That's very true. And I don't know. I think the hope and expectation and plans, as far as I know, are to keep that timing and to get the rule out as soon as possible, which is why
Right.
it was so jarring that it wasn't in the agenda, didn't seem to be in the agenda.
Mhm.
But we also will point out that the corresponding ONC rule, which we hope is that November 2023 rule that doesn't have any specifics around it, would need to have similar time frame for the entire process to go smoothly.
Yeah, and then these last questions, these dates, like April 2024, March 2024, that's when they're going to be addressed on the unified agenda. So that's when they're
So
slated.
that's right. So that's the expectation for the activity that's listed. So the expectation, if it says that it's a final rule, the expectation is that the final rule will be released at some point within that month. Now, it's not exact. It doesn't mean that it actually will, especially as you get further out. But the plan is that the expectation and what they're working toward and what they're planning for is for a release at some point within that month. So if it says NPRM, the expectation is that the proposed rule will come out at that point. And then once the proposed rule is out, the next time things get updated, that they will often, usually, but not always, have a date for the final rule, especially if the comment period is already passed, because they also note the comment periods on these entries. So like if you were to look at the HTI1 entry, what it has right now is the date that the proposed rule went out and the date of the comment period. If you look at the attachments rule, it actually lists the date that the rule went out, the original deadline for comment, the date that the comment period was extended, the new deadline for the comment, and now it has the proposed final rule date. So it stops at the last known thing and it adds things one by one. And it typically, at some point, the next item, and unless it's already a final rule, the next item will get added when they know a date for it. So some of the rules, like HTI1, is sitting there in its current state, which is why I didn't put it on this list. There's no date of next action on it, like when it might, they don't have a date for when it's finalized. So that's part of why I was particularly surprised to not see the CMS prior auth rule, because it could have been listed, but in that state where it didn't have the final date on it yet.
Yeah. Yeah, and
So-
it's surprising to see the attachments rule on here as a final rule because there was lots of comments on that rule about standards and it's
Exactly. I was very
outdated.
surprised.
That's shocking. Yeah.
And perhaps that's why it's so far out, because they're working through some of that. But yes, I was surprised by that too. I thought there would either be a new proposal or maybe even a withdrawal until they figured out what to do about it.
Yeah.
But anyone have anything else they want to?
This is Janice. This isn't, collectively exhaustive, right? I mean, there could be, as you said earlier, if I understand correctly, for example, a final prior authorization rule issued whenever that would fall within this time period, but wouldn't necessarily be part of the spring unified agenda. Is that right?
It's not supposed to happen that way, but according to Alex's response to the question, that is correct. Now this is maybe 10% of the items that are listed for HHS. So this is also not exhaustive from that perspective too. I pulled out the ones that I thought affected the things that we care about.
Okay, thanks.
So there's two different components there. But there's also things that could come up that are not yet planned that may still happen in a hurry or happen during this time period, especially in terms of if there are proposed rules or RFIs that are not yet known to be needed or that come out without a lot of fanfare. I expect there to be more No Surprises Act stuff, for instance, unless that rule is gigantic and includes like 8 gazillion things. That's only a subset of what's still remaining. So there's definitely other things to expect. And as we've seen over the past few years, there's often things that come up unexpectedly. You'll also note that there's no explicitly AI related things on this list. And some of the AI activity is bound to result in some additional regulation at some point in the not too distant future. So I would not think of this as exhaustive, but I would think of it as a hint about what to expect and when to expect it. All right, let's move on. So I'm going to pass off to Dave Delano in a second, but NCVHS has formally recommended the adoption of new CAQH core operating rules as well as updates to some of the existing rules. And I'm going to pass off to Dave to just briefly discuss this.
Sure. I don't know if folks recall, but there were recommendations from CAQH Core back in, I want to say, the summertime to NCVHS to adopt these new operating rules. And as folks also recall, CAQH Core is the designated HIPAA mandated transaction operating rule development entity. So it's a mouthful, but they basically make the operating rules for the HIPAA mandated transaction standards. We participate, MHDC, Janice and I participate in some of the CAQH Core work groups for development of these new operating rules. And we're currently sitting on a value-based care work group and helping to develop value-based care operating rules for transactions related to value-based care. That all being aside, what happened, the process is that CAQH makes recommendations to NCVHS, NCVHS then makes recommendations to HHS. I think it was on the 20th, June 20th. I'm trying to remember when the letter came out, but there was a letter that NCVHS sent to HHS, the secretary, recommending the adoption of these new operating
June
rules.
30th, it's on the bottom link there.
Oh, there it is. Yep, June 30th. Yep. So that's when the letter came out. So, roughly 20 days ago or so. So now HHS has to consider the adoption of these operating rules, and as they're written or as they've been recommended by NCVHS, essentially these are changes. The top ones are all changes to existing rules or adopted, updated versions of currently mandated operating rules. The connectivity rule is just that. It's essentially the API connectivity standards for exchange of both X12 based transactions, but it also includes the ability to use RESTful API transactions within that connectivity rule. So we're very supportive of this new version 4.0 of the connectivity rule because it opens up the possibility of sending things like attachments and other capabilities that you can't do with the current connectivity standards. So that's a good thing. Most of these are good things, and us here at MHDC and pretty much voted and supported for the adoption of most of the content or most of the suggestions in these rule changes. Just briefly, eligibility and benefits content rule includes things like whether a prior authorization might be required for a particular procedure. So there's changes to the 270, 271 eligibility and benefits inquiry and response transactions to include things like that, which is great. It's all good stuff for obviously moving the standards forward. The infrastructure rules, there's three types of rules. They have data content, connectivity, and infrastructure rules. The infrastructure rules are things like, data response times, uptimes, things like that. So these are all improvements in those standards, which are also beneficial for the industry as a whole. Claim status infrastructure rule is the same type of thing. It states things like response time on a claim status inquiry should be within 2 seconds, and things of that nature are built into those infrastructure rules. So the claim status inquiry in response 276, 277 infrastructure rule is along those lines. And then same thing with the payment and remittance 835 infrastructure rule. Again, mostly operational technical standard updates there. But the last one that's new is the eligibility and benefits single patient attribution data content rule, which essentially allows for, within the eligibility inquiry and response transaction, the ability to attribute an individual patient to a provider panel for value-based care or other activities related to attributing patients to their panels when it comes to VBC contracts or other ACO type arrangements where patients are essentially assigned to or attributed to a particular provider panel. So that's what's included there, and that's a new rule. It's a kind of a good new rule as we move forward with more and more value-based care programs. So that's it in a nutshell. And I think, as we said, mostly all the things here are good things. There are some proposed upcoming more changes to things like claims themselves, to include additional details in benefit responses on claims, to include things like second and third tier levels of benefits and additional details there for more sort of more claims assignment or adjudication capabilities. So there's more to come, and this is what's out there now. So, yeah.
Thanks, Dave. Anyone have any questions about any of that? So sometimes takes a little
Yep.
while for these letters to weed their way through to being surfaced publicly. So, but we found out about it, so we're letting you know.
Yep.
All right, well then let's move on. Thank you again.
Sure.
All right, so new proposed rule. So this is a Medicare physician fee schedule, but one of the things that most of it is about payment and not really stuff that we're gonna take a look at too closely. But do you want to point out that it will now cover social determinants of health risk assessments? And also there are some extensions to the covered telehealth services. They're all temporary, but some of them are entirely new and some of them are putting back into place some expired pandemic era exceptions for a temporary basis. So for instance, you'll see health and wellbeing coaching is completely new. The ability to furnish services to any site in the US was a pandemic exception that they're putting back in place. And extensions for various types of occupational, physical, and audiological therapy and services, I believe is new as well. Some of it may have been supported during the pandemic, but I think this is an extension of what was supported there. So, but I think the last one, so all of this, most of these I believe are basically extended through the calendar year 2024. You can find some more information at the CMS fact sheet. But anyone have any comments or questions here? All right, then moving on. Hot off the presses. Yes, came out on Monday. We found it yesterday. CMMI, excuse me 1 second. So CMS has issued an RFI on episodic models of value-based care. It came out on Monday. The deadline for comment is August 17th. They're giving basically a 30-day comment period. And they're looking for feedback in the areas listed on the screen with goals to improve care transitions and increase the engagement of specialists. We have not had a chance to look at this RFI in any detail. I do think it's one that we're likely to at least consider responding to, but without having looked at it in detail, I can't tell you that for sure. And obviously, of course, the timing is short, so that may also play a factor. Any questions or comments there? All right, well, I'll just add, they specifically talk about quality measures, interoperability as things that they're looking for feedback on. So I think that's good. All right, if there's no further comments, if you'll go to the next slide and stop there for a moment. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.